Happy first term, everybody. Welcome to the ERC seminar, our monthly luncheon. It's collaborative with the Center for Injury Reduction. I messed this acronym up. Injury Research and Policy, and the PO, Total Worker Health Center, and the Education and Research Center. That's the ERC, NIOSH funded center here in Johns Hopkins. I don't know, but it's Monday. How about this? Two hydrogen atoms walking down the street. One looks at the other one and he goes, I think I lost my electron. The other one goes, really? He goes, yeah, I'm positive. All right. Yeah, great Monday banter. Well, I'm glad to see everybody. It's been a long summer, early fall. Missed you guys very much. Today's our welcome luncheon. It's our orientation. We're just gonna bring all the directors up, talk about the ERC, its function, our students, anything new, anything old, changes, this and that and the other. Get to connect some faces to the names from all the emails we get an idea of what we eat for lunch on the first Monday of every month, okay? So we'll start out with our director of the ERC here at Hopkins, Dr. Ramachandran. Lead us off here going through today, okay? You go, Ram.
Thank you, Chris. I just ran and drove across between two campuses to get here on time. So I sound a little out of breath. I have a good reason for it. Yeah, Chris, you put me at a disadvantage. I don't have a joke. So, I have a Catholic joke if anybody is interested. I told that to my son. So he was taking his SAT exams and it was at a Catholic school. So I told him this joke. So I said, there was this kid not doing well at all in math. And his parents tried everything, put him in, special tutors, put him in like Montessori, put him in private schools, nothing worked. And then they put him in this Catholic school. His grades immediately improved. And so it's like, wow, this is amazing. I'm not going to question it, but what happened? So the kid said, I walked into that school the first day, and there was a guy nailed to a giant plus sign. And I knew the people meant business, so anyway. So anyway, let's get started here. So welcome to the ERC annual luncheon. And this is a time when we get together, assess where we are and what we are doing right and what are the plans for the future, especially important today. So we are focused on interdisciplinary education, research, and practice. And these pictures here show our students across the various programs in the ERC engaged in joint activities, whether it's in the Anna Bajer course, more of which I will talk about, our joint labs, joint seminars such as this one, both weekly and monthly. And so there's a lot of activities that our students do together. And so that's the interdisciplinary education part. Our students are also engaged in research, many of them, especially the PhD and DRPH students. And so they are part of the research. We also give out funding, and we'll talk more about that, for pilot projects. And many of our students have benefited from it, as well as researchers from around our area. And then we have a fairly extensive continuing education and practice and outreach component of the ERC, and Chris leads that effort. So we are one of 18 such centers around the country, And so we are listed as number 10, but actually we're one of the earliest ERCs to be founded. And so we cover what is called as Federal Region 3, Maryland, Pennsylvania, West Virginia, Washington, DC, Delaware, and Virginia. And our mission is to build critical capacity by training the workforce in occupational health and safety for the nation in various areas of occupational safety and health through the multidisciplinary education and training. And so that's like the students here. And then the second part is, like I mentioned, we have this extensive education, continuing education and outreach that is meant to improve skills and knowledge practicing occupational safety and health professionals in our catchment area. And then research. So there are the three sort of legs on which the ERC stands. So this is a slide I presented last year. I'm going to present it this year because this is a summary of previous 5 years. And so it's a more robust data set than if I had just presented last year, year and a half data set. So, and it looks more impressive, more numbers, everything. So, so in the last 5 years, our faculty and students have published more than 500 peer-reviewed publications. So that's 100 a year, which is a very impressive track record. And I don't see any indication that this has slowed down at all. If anything, it's sort of ramped up. And so we are having a huge impact on occupational safety and health through our peer-reviewed publications on the research agenda for this country. We have a lot of doctoral and master's students, and then we have graduated. And today we'll have the various program directors talk about their individual programs and the number of students currently in each one of these programs. We have trained more than 4 million professionals, 35,900 person hours at 1,400 companies to 107 courses. Again, that has shown no sign of abating. We have, one of the things that we do is, I'll talk more about this later, is we reach out to our elected representatives and their staff, and we sort of make a case for why we are important for occupational safety and health. And so we sort of provide annual information on this, and every year we have like this incredible track record of helping professionals in the states covered by Federal Region 3. Our faculty have leadership positions in national and international bodies, National Academies of Science, EPA, the International Society for Exposure Sciences, OEMR directors, chair, the National Center for Environmental Health and ATSDR, journal editorial boards. Some of these national organizations are in trouble. We'll talk about that. But we have been having a profound influence at a national and global level. And then many of our faculty also have a significant local and regional impact through community organizations. How does the ERC support you? Through a variety of ways. We, of course, provide the education and training. And as many of you know, we provide support, financial support, tuition support, stipend support for you to be in school, and especially our PhD doctoral level students. The various programs support salaries for the faculty to be engaged in teaching various occupational safety and health courses. It provides funding for travel to conferences. It provides teaching opportunities for our students, especially our doctoral students, to engage in, get training in teaching, partly as teaching assistants, but also partly as actually lecturing in courses. Certainly research project funding, and we have pilot projects that Anna Rule will talk about later. There's opportunities for interdisciplinary projects. There's the ERC Seminar Series, and this is one of them. Today is one of them. And then we have a variety of wide range of continuing education courses. Okay, so let's talk about the big elephant in the room. As many of you are aware, the occupational safety and health infrastructure in this country has been subject to a huge, significant funding cut. NIOSH especially, which funds our ERC, the staff have been reduced by around 85 to 90%. And there is a reorganization at the federal level. And the initial, it's not clear what that means for NIOSH as a funding agency. We thought we were going to be out of business last June, but then we got a reprieve. And without going into all the details, we are very grateful for the reprieve. We are hoping we'll get another reprieve, but I'm not counting on it, but we need to be realistic about it. So anyway, it's a huge uncertainty about what the future holds. And as a result of this uncertainty, we have been careful about admitting doctoral students using ERC funding. We've also been very careful about admitting OEM residents, again, for the same reason. For both doctoral students, as many of you know, and residents, we as a school make a commitment for an extended period of time, more than 1 year. So for doctoral students, we make a 5-year commitment to fund. And we really cannot hold up our end of the bargain if our funding source is uncertain. If we cannot fund it, then our backstop is the department, and their backstop is the school. And it's not a problem that affects only NIOSH as a federal agency. Many federal agencies are under threat, so the school cannot realistically backstop us. So with the result that we are sort of saying, okay, let's see what the future holds before we restart. But we have been coordinating with other ERCs. We're sharing what each of us is doing to deal with admitting new students, dealing with our university administration, with our department chairs. And most importantly, we are reaching out to our congressional representatives and senators and their staff to educate them about the importance of occupational health. It's not a partisan issue. And so at least in our outreach to the congressional representatives and senators, we've had sort of bipartisan expressions of support. Whether or not they actually vote our way, that's a different thing. But at least when we go to them, they are like, very encouraging, and they are very supportive of what we do. So that's a good thing. In addition to us directly reaching out to congressional representatives, we're also working with professional organizations, and like the American Industrial Hygiene Association and other occupational medicine programs and residencies. And so we are reaching out through those professional organizations as well. Many of us in the room have written articles for newspapers, professional magazines. We appeared in podcasts. So we are doing all we can to the extent that we can. Whether or not we are effective remains to be seen. But I have to say, there is, even in publications like Bloomberg News, which is all sort of about business stuff, there are articles supporting the work that NIOSH does. And we have been, we meaning NIOSH or the occupational health community, we've been referred to as sort of the ultimate consulting company with the right price, this is zero. So, and very high quality work. And so there's a lot of support for this group, and we just hope that it translates into a positive action for us. even though we have this uncertainty around us, we have been told, so our occupational health psychology program got funding for just 1 year. And so we've been told to reapply, which is again a positive sign. It says, that, all is not lost yet. And so we are going to resubmit, and our occupational health psychology faculty are engaged in working on that proposal, which is going to be due very soon. Don't know the exact date. Any questions or any other comments from other faculty or? Yes.
The only thing I would add is, although we've been reaching out to our elected representatives, I encourage all of you to consider if that's a part of the American system that you would like to be a part of, to advocate for the ERCs or whatever else you feel you should advocate for as public health students.
Yes, absolutely. Please reach out to whoever you think might make a difference. Yes.
I know y'all sent a message like last May or June. If y'all have those like messages, like recommended text, those are helpful. The kind of.
We can actually, that's a great idea. We can certainly send suggested. Absolutely. That's a great suggestion. Yes.
We have been told that although, many of the doctoral students in particular are receiving funding, that's less what they're interested in. They really want to hear about your research, how you're interacting, how you're making a difference, how you intend that your future career will make a difference.
Yeah.
Those are stories that'll like really resonate with policymakers and their staffs.
Right. Yes. Yes.
What happens to current students if the ERC goes away?
So
Move to department funds or?
yeah,
Okay.
the department will, the department has assurances that current students will finish up their degree and they'll provide the support to make that happen. Yes. Is that? Any other questions? Yes.
As you've mentioned, speaking with the other ERC directors across the country and some of the education advocacy of Congress, I'm wondering if you've heard how they're approaching the engagement with students and decisions about whether they're going to be able to fund, because I think, I'm just wondering, is it a collective thing across all ERCs that NIOSH is going to have to consider if there's sort of a downtick in the students that are, being brought into the training grant because of this uncertainty?
Right. No, that's a good question. So different universities have different approaches to how much assurance they are going to give students. So we are saying we'll support you for 5 years, no matter what. Many universities do not do that. Some do go year by year. And so those universities are still admitting students. And I mean, in their letter of admission, they provide the adequate sort of caveats and all that. But still, so we cannot, because of the policies in our school and department, we are not able to do that, but other universities are. Okay. So I'm going to leave this sort of numbers up here and just say that many programs are still going strong. The numbers are a little bit less than what I would have shown last year, only because we've not admitted students, especially doctoral students and residents. But we have continued admitting master's students. Some of the programs are, like the occupational health psychology program, we are hoping that it'll get refunded, and we have one student in it. And that student will obviously continue to get support to finish her degree. There's the occupational environmental health nursing program that has 3 DRPH students. And the nursing program sort of went away a couple of years ago, but we still have students and we still continue to support them, and we have provided assurances that the department will continue to support them until these DRPH students go finish up. So I'm going to stop here and ask our first, oh, I got one more slide here, I guess. These are the different ERC program directors. And I will ask each one to come up in turn and describe, say a few words about their program and the current status and where the students are. And so I'll first call Kirsten Kohler to talk about occupational environmental hygiene.
Everyone, I'm Kirsten Kohler. I'm the director of the Occupational Environmental Hygiene Program. Our core faculty are Ram, Anna, Wave, Leslie's online, Wave. And we direct this both master's and PhD students within the program. This is a current list of our students. We have both PhD and DRPH students, as well as a master's program. The master's program courses are here at the School of Public Health, but it is administered through the Whiting School of Engineering and Engineering for Professionals for the part-time students. So we have still a pretty good cohort. We have a bunch of students who've completed coursework and just need to finish their essays. Some newer students. Are any of the master's students in the room? No, I'll introduce you. And also some new online part-time students as well. PhD students, you've been here. I'm not going to make you introduce yourselves again. But as a reminder for the PhD students, you're all part of the SE track. The SE, this is part of the SE Journal Club. I see a few of you online. Thank you for joining. I'm going to be nice this week since probably a lot of the senior students have seen this presentation 2, 3, 4 times. But 30 next month, please join us. It is part of the Journal Club to attend this. You don't have to prepare anything, just show up, be a part of the discussion. We get great speakers. Is that all I have? So here's some photos. Are we talking later about the classes? I think you'll talk about Anna Bacher and IH Labs. So, you know, fun experiences through the coursework in the department that also allows you to engage with faculty, businesses outside the university, learn hands-on skills, meet some of the master's students. So I invite you to participate in those things. We also have a presence, particularly at the American Industrial Hygiene Association Conference and Expo. These are some recent pictures. Actually, the one at the bottom is even from last year. Thanks, Anna, for updating that. And there's Grant and Sal presenting posters at relevant events. So if you're interested in attending that conference or others, please talk to your advisor, your program directors. We'd love to be able to highlight your accomplishments at these events. I think that's it for me.
Next, I'll ask Lori Edwards. I don't know if she's here. I guess not. Okay. I'm going to skip over the occupational health nursing program. We have 3 DRPH students, and they are in various stages of at various stages in their DRPH program. They're all making good progress. And I'm going to skip over that and reach out now to Albert Zhao.
Thank you, Ram. Hey, good afternoon, everybody. My name is Jishin Zhou. I go by Albert, directing the OHP program after our previous director departed Hopkins last year. So as Ram mentioned, our program was new. It was funded for 1 year in 2023, and then we submitted a resubmission last year. Sorry, it was funded in 2022. Then we submitted a resubmission in 2023, was not funded. And then we resubmitted again last year, but it was not reviewed because all the federal landscape changing. As Ron mentioned, we were positive that, we feel more positive that they welcome a resubmission, which we'll do in 2 weeks. So we'll hope that this resubmission will be funded, and then we can continue funding our recruitment of students and the research about occupational health psychology. So right now we have 3 people who are involved in the program, although we don't have funding, but we still continue our efforts in this program. So I'm from the Department of Mental Health. I'm an associate professor who joined Hopkins in 2023. We have Megan and Judy, who are the co-directors of the program. And this program, as I mentioned, was launched in 2022 and was about the safety, well-being, and health of workers. So it's about how we can apply psychology and other principles and bring interdisciplinary research and practice in the workplace to focus on the mental health, well-being, and safety of workers. So right now we have faculty who are from the mental health department at EHE. And then we are, in our application for the renewal of the program, we want to launch a graduate certificate in total worker health and public mental health. We're hoping that if we're funded for the application, the certificate program will open opportunities for other departments, a student from other departments, a student from the school, and even student from non-degree seeking purpose to get a certificate on total worker health. We have currently one a student who was admitted through International Health, Lana. She has just passed her preliminary exam last Monday. So she's making great progress in her training and development. Since the funding was for her training stopped this summer, so now she's funded through IH. I think if we are, hopefully if we get it refunded, then we may be able to support her and also support additional students that can be recruited through mental health or HE. We also have a course as a part of the certificate program. Megan developed the course in 2024 and launched in 2024. It's about total worker health. It's an online class. It was really well received. It's offered in the 4th term. So in the upcoming 4th term, it's going to be offered again. If you haven't taken it, I would recommend you look it up. Here's a quick introduction to the total worker health course. All right. Thank you.
Next, I'll invite Dr. Aisha Rivera, who's online, talk
Hi,
about
everybody.
the occupational medicine program.
Hi, everybody. It's
I'm
so
happy
nice
to move the
see
slides
you.
along, Aisha.
Oh, yes, please. I would have figured that
Oh,
out
wait,
when
hold
I
on.
tried to click.
Hold on,
Can
hold
you
on.
hear me?
We cannot hear you.
Oh,
Yeah, Aisha, it sounds like you're just coming through our kiosk here.
can you hear me now?
Let's see.
That's odd. I can hear you. Can you hear me?
Okay. Yes, I can hear you.
You can hear us, but we can barely hear you. It's like it's just coming out of the monitor. It's
Okay.
an exercise in quieting your room.
Okay. So let me know, do you want me to try to go through, or do you want to skip over me and move on to someone else, or? Chris, should I go ahead?
Can you hear us, Aisha?
Yes, I can hear you guys, and the folks
Okay.
online can hear me okay. Can you guys hear me?
We fixed it. We can hear you.
Okay, awesome. All right. Hi, everybody. It's nice to see you. As Ram mentioned, Aisha Rivera here. I'm the director for the Occupational Medicine Residency Program. And, you know, a lot of people get occupational medicine physicians confused for occupational therapists. We are a legitimate medical specialty under the American Board of Medical Specialties, specifically under the American Board of Preventive Medicine. And we focus on the prevention, diagnosis, and treatment of work-related injuries, illnesses, disability, and death. We are very small, as you can imagine. We are primarily dependent on ERC funding to exist globally as a specialty, which is in contrast to a lot of the other specialties which are funded through the Centers for Medicare and Medicaid through GME payments to hospitals. So there are about 19 two-year training programs in the United States at present. And we're going to move on to the next slide. Anyone out there? Next slide.
Yeah.
Oh, it's not changing over there. It's not?
All right. Awesome. Sorry about that, guys. So our mission is to train physicians for leadership positions, regardless of whether they choose to practice in a clinical setting or a population health setting. And we want our trainees, our graduates to be fully prepared and to really be role models and thoughtful, inclusive leaders. We have over 160 alumni. And once they graduate, they're expected, strongly encouraged, and in fact, the Accreditation Council for Graduate Medical Education uses board certification as a way to track how well the program is doing. So our graduates go on to take the American Board of Preventive Medicine examination for occupational environmental medicine. We have a 100% board pass rate. And we're going to move on to the next slide. And we are very small this year because, as Ram alluded, we did not take any new residents into the program. So we have our current residents who were promoted into the second and final year of the program on July 1st. So Dr. Rob Allen and Dr. Jessica Rue, and this is a picture from our residency fair at the American Occupational Health Conference. Next slide. And our program staff and faculty. We have a program coordinator position that's split between April Lovelace and Dottie Beecraft, and they're housed within the School of Public Health. They also support our sister residency program, the General Preventive Medicine Residency Program, which is a school-wide program. And then our internal to Hopkins faculty, Dr. Brian Schwartz, myself, and Dr. Louis Faison, who are all based out of the Department of Environmental Health and Engineering. Next slide. And I think it's really important to mention that we depend on faculty who are external to Hopkins for a number of our rotations. So Dr. Virginia Weaver, who's on the left here, she actually was in my position several years ago. She is now over at the Occupational Safety and Health Administration, and she serves as the rotation preceptor for our residents who rotate at OSHA. And then Dr. Marian Cloran, who's one of our program alumni, she's over at the University of Maryland. They have an occupational medicine program. They do not train residents. They serve more as a consult service with a number of different projects. And she serves as both the rotation preceptor for the University of Maryland rotation for our residents, and also she serves as our program evaluation committee chair. Next slide. So in addition to the MPH program, in the first year of the residency training, our residents, as I alluded to, they participate in rotations in their second year and clinical rotations in both the first and the second year, but we have a number of other curriculum elements, including, as somebody mentioned, the SE Journal Club, these ERC seminars. We have our own resident seminars, which are typically held on the first Monday of every week. And we partner with other area residency programs like the Uniformed Services University of the Health Sciences to do things like objective structured clinical evaluations. We have standardized patients come in and pretend to have a particular issue that our residents are then tasked with addressing. We have research projects. Our residents are all required to participate and complete a research project. They typically present their research at the American Occupational Health Conference in the spring. And then we participate in every year in the fall Mid-Atlantic Regional Conference for OEM, which actually is going to be held at the Bloomberg Center in DC this October. Next slide. And so this is our announcement. I've been telling everyone about this conference. If anyone is slightly curious, you are all formally invited to check it out, happening later this October. Next slide. And these are just some pictures. You know, pictures are worth 1,000 words. So some of our residents participating at AOHC. Next slide. Thank you so much for your time.
Thank you, Aisha.
Thanks, Aisha. I'm Chris Heaney. I direct the Occupational Epidemiology and Biomarkers program. I took over in 2018 from Dr. Paul Strickland, and over the years, we've had several transitions. We were really excited to have Dr. Aisha Dickerson in epidemiology join and take over as Dr. Eliseo Guayar left Hopkins to go be department chair at the NYU School of Public Health Department of Epidemiology. It's been wonderful with the featured course in environment occupational epidemiology for this program, which is required in the 4th term. It's been great to co-teach that with Aisha for the first time last year. We also cross over with Dr. Leslie Quiroz-Alcala, who's joined this program as well, and John Grutman, who now has obviously transitioned to be interim chair, has been a part of this program. And a lot of this is the evolution of programs over time. I say when I took over, it was more focused on toxicant chemical exposures and epidemiologic studies and biomarkers to represent exposures to PAHs with John Grutman and Paul Strickland's area of research. And we've kind of evolved to also integrate other agents and infectious diseases with a lot of the spillover and pandemic concerns. We have in the past, had anywhere from 5 to 10 doctoral students, trainees with, sort of 1.5 to 2 students who have slots. And now we have one, we actually technically have 2 going into the July 1 inflection point for the ERC with a student who graduated, Katie Kurowski, and stayed on just into the new year of the ERC. The students who've graduated out of OAB have gone on to do a diverse range of careers. Academic is one. We've had students who are at the Environmental Health Sciences Department of Columbia. Recent graduate Katie Kurowski's at the Children's Hospital of Philadelphia, doing a lot of work with the infectious diseases biomarkers. The Walter Reed Army Institute of Research, and also academics transitions into leading nonprofits with Vanessa Kaufman doing Stop Foodborne Illness. And then I think it's also good because in the biomarker space, there's opportunity with students who are interested in getting into the biotech sector to get relationships. And so Flagship Pioneering is one. Previous trainee, Dr. Pranay Randad, has done great things with spinning off biotech ideas into companies. And other students within this infectious diseases biomarker space have gone on to work for Amgen and Horizon. So diversity of career pathways. In addition to Katie Kurowski, she graduated. We were so excited to welcome her on, to encourage her on to her next steps. So I didn't put her up, but she finished in March, but she stayed on through the summer and transitioned to CHOP, I think, in August. But Margie Toman is currently a 5th year. So great to maybe say hi to everybody, Margie. Doing really, really great work in the Geisinger health system with Dr. Brian Schwartz, looking at the environmental drivers, air pollution, and other environmental factors that contribute to really great insights into chronic rhinosinusitis, which involves some really elegant and important biomarker technology. I think that's it. Thanks so much.
Invite Dr. Mary Fox to talk about occupational injury.
Thanks, Ram. I'm Mary Fox. Greetings from Health Policy and Management. So the Health Policy and Management branch of the ERC is the Occupational Injury Epidemiology and Prevention Program. And yes, I think, Chris, you mentioned early on that this is a partnership with the Center for Injury Research and Policy, which is based in Health Policy and Management. Our fine faculty here you see on the slide. I have just taken over for Cass Kerfasi to direct the program. Cass is still on board as faculty, as well as our dean is still on board as faculty with us in the ERC. Jonathan Asani, Renan Castillo, Shannon Ferretaroli round out the team here. And just to say a little bit about the topic areas, so violence and suicide prevention are areas of specialty, transportation safety, trauma care. And in terms of the types of worker populations, firefighters and first responders are people that we have strong relationships with within our program, as well as military service members and veterans. And as you will see shortly from our student research. So we currently have 3 students. 2 of them are here with us today. Kim, Yvonne, you want to raise your hands? Thank you. Thank you for being here. So all 3 of them making steady progress. Stacy and Yvonne, I think, are at the proposal stage, and excited to say that Kim has moved on to actually conducting research. So we're very pleased and proud of them making great progress through their training. I think that's it for me. Great.
Chris, can I have you come and talk about continuing education?
Me again. Hey, I'm Chris Spicer. I direct continued education and outreach here at the ERC. Actually, Keith does it. That's Keith Choi. He's the senior program coordinator. And I just talk. I'm the talking head here. Yeah, my chief concerns are taking what we do, what we know, what we learn, and getting it out of here, right? And then taking what's out there, the private sector, other organizations, other colleges, state, federal institutions, bringing them in here. But like me personally though, like just to make myself available to people, I'm technically faculty, but I'm more of like a soft skill. I don't know what to do right now. Let's talk it through, kind of empower students, get folks together to move forward, take on challenges. I think I just convinced Shilpi to be a presenter at the March PDC convention for ASSP AIHA. So, but things like that, that's kind of what I do. Here's a lot of the collaborative partners that we have. That Mary Doyle, who is my predecessor, just retired last year, built up, and we're trying to continue on what she's laid down and then nudge it a little bit further. But as you can see, I live in a world of acronyms, yeah, as we all do. So here's my acronyms, our acronyms. But really, you know, if you want to get out into professional organizations, conferences, present what you're doing, you know, let me know. Let me highlight what you do. I took a conversation with Shilpi last week to get a good understanding of what the homework study is. I was like, this is fantastic. It's a perfect occupational health track for a professional development conference. Let's get you slotted. And that's what we did. Let's see here. Where's the next slide? There's some of the conferences. We had, what is it, March 6th last year. or this, it feels like last year, but it was this year. Yeah, gosh. What a year, right? It was a great one. At the Applied Physics Lab, we collaborate with the AIHA local section, the ASSP local section to put on a 1 day, 4 learning tracks. There's industrial hygiene, construction, safety, occupational health, and then safety tracks, at the Kasayakov Center there at APL. It's fantastic. I think we're looking to probably have about 200 to 250 people there this year. I'm the chair this year. Like known everybody for about a year, and now I'm the chair. It's threatening, to be honest. But again, I'm placing all of our occupational health speakers. So 1 hour slot. There's opportunity there for anybody that's interested. Let me know. The KOC hearing conservation, we collaborate with Frank Wardinger of Earmark Hearing Conservation from KOC to put out initial certified occupational hearing conservation certifications and renewal. I think it's a 2-year renewal, 3-year renewal period. But we collaborate with him to do those. Those are my favorite letters behind my name. I've got a COHC behind my name because I can read an audiogram now. AIHA Connect in Kansas City, Missouri this year was fantastic. Ryan was there with us. Anna and I spent a lot of time at the booth together. Ram, you buzzed around quite a bit too. Yeah, AIHA and our ERC are very close, very close. The AHMP EHS, the Hazmat Summit. So my background, my private sector background is in hazardous materials response, remediation, industrial services. I have actually just been appointed as their chair for professional development for AHMP, the Alliance of Hazardous Materials Professional. So you're going to be seeing some opportunities there. I'm looking at putting together a monthly trivia night, right? It's for AHMP, and I would like to invite everybody, and it's DOT, IATA, FRA regulations on transportation, storage, disposal of hazardous materials. Any EHS professional, this is going to be part of your life, right? So these are the ones that most people get. Private sector companies capitalize on people that don't understand what they're doing with hazardous materials. And so does regulatory agencies. So bringing this type of knowledge base to us is something I'm going to be aiming to do over the next year. GRLI, that Leadership Institute, was this summer. I wasn't really close to that. We took care of the registration and the website for that. And then Markham, as Aisha was saying, it's coming up the end of this month at the Bloomberg Center. It's going to be the first time we've hosted something at the Bloomberg Center this year. We're really excited to do this. Some CE modules, some continued education modules that you'll see on the ERC website under continued ed right there. The OHN online review, that certification of the CNE is going to expire in November. And it's been since before COVID that those modules have been updated. And I believe we are just going to let that go out to pasture. Okay. AOHN has also created their own online preparatory course for occupational health nursing certification and has done quite a great job of it, but it's definitely out competing what we do right now. And then Pocket Map's getting ready to go live, targeting November. You'll see that it's emerging technologies. There's going to be about 23 courses that can qualify for different types of continued education credit. More to share with that as it comes out. That's the OHN review course here. It's been a great run with that, guys. And then here's my favorite thing today. Our MS, I wish we had more of the master's students here, but our MS OEH program has been qualified for, it's been considered a qualified academic program for the Board of Certified Safety Professionals. So if graduates from our program will walk out with they can apply to become a graduate safety professional, a GSP, which is just, if you want to start stacking the alphabet behind your name, we've qualified the MSOEH program to take one of the steps out of that for to get towards the certified safety professional certification or credential. I've also done that with IHMM. That track, the Masters in Occupational Environmental Health or Hygiene, is also approved by IHMM for the Student Associate Safety Health Manager, the ASHM, which is on its way to getting the Certified Safety and Health Manager, CSHM credential. Just to add some value, that the name of the game when you get out there is letters behind your name, right? Also affiliations with these communities. It helps the network out, helps you with recognition. So I was really excited that we've done that. I'm actually putting together my own application for the GSP myself.
Chris, I had a question. So do they have to take an exam for that?
For the initial, you don't have to take an exam. For the final certification, the CSP and the CSHM, there is an examination. Yes. And with that, just make myself available to everybody. So thank you.
Being a qualified program means students can sit for those exams sooner.
Yeah.
It's like fewer years work.
Yeah, you get years taken off from the required number of years that you need to do. Yep. So thank you. Thanks, Chris. Thanks, everybody. So I'm going to talk a little bit about the Pilot Research Training Awards. We have actually one program based out of the ERC and one program based on the Poe Center. They're very similar, so they typically run together, but because the NIOSH funding didn't come together at the same time, we actually announced the proposals separately, but I have all the proposals actually together and ready to make some announcements, but need to talk to Ram first. So actually there's here, right? So the goals are to enhance research training capacity in both centers. Like Ram was saying, we occupy region 3, but for the Poe Center, it's a little broader because it goes all the way to New York. But this year, unfortunately, we could not include any of the other universities. And so the goal is to explore and develop new and creative projects that are based on the NORA priorities, the National Occupational Research Agenda. Like I said, requests for applications were already advertised. So sometimes I use this platform to advertise, but today I wanted to announce the awards. So the review process includes some rigorous reviewers like Dr. Lippi, who's like really tough with the proposals, but gives excellent feedback. And so some examples of research activities, like for collection of preliminary data, feasibility studies, travel cost to field sites, data entry, funds for reimbursement of participants, or cost for analysis. And so in the past year, we awarded 7 ERC and 6 POE proposals for a total of 13. And here's just like a breakdown of 2 of them, junior faculty for ERC and 1 for POE. You get the picture. And so I received 7 proposals for POE and 8 proposals for ERC. And we are evaluating the funding available to make decisions, and hopefully this week, by the end of this week, you'll get some results. Thank you. I think the next one is already.
Actually, one thing, Anna forgot to mention, we would have supported fewer than the numbers that Anna showed, because she had like the foresight to approach the provost's office for funding, matching funds. And very surprisingly, they just said, sure. And then we forgot about it completely until like, I don't know, last week, 2 weeks ago, she said, Ram, what about the provost thing? And it's like, what are you talking about? So anyway, she reminded me. Anyway, so the provost office is still, willing to support it. So, which is why we are being able to make the number of awards that. Yes. Am I accurate about that? Okay. So anyway, so thank you to the provost office also. And at the very end, I want to acknowledge our key staff, both of whom there need no introduction. Jane Taylor, who's the ERC administrative manager, and she sort of makes sure that all of you get paid on time. All of you are registered. All of you are sort of making the adequate progress. So she's keeping track of everybody. And so that's from your perspective. From the faculty's perspective, she makes sure that our annual reports go out on time. She makes sure we are writing our parts of our annual report and sending it to her on time. And then she edits them, make sure it all makes sense and it sort of hangs together as a coherent report. So she is like invaluable, and thank you very much for all your work. And Keith Choi, who's our senior program coordinator, again, he plays a key role. As Chris mentioned, he does a lot of the continuing education and setting up the conferences, setting up our online presence. Chris briefly mentioned Pocket Map, which is this educational initiative putting out educational modules on various aspects of occupational health and emerging technologies. And Keith has again been instrumental in putting them all on YouTube and getting them out. So again, so thank you very much, Keith, for all. So I will, at this point, ask Anna and Louis to come up and talk about the Anna Bajer course.
My co-instructor, I know. So we are fortunate to teach the funnest class in the whole of Johns Hopkins University. So this is known to us as the Anna Bajer class, but the actual formal name is the On-Site Evaluation of Occupational Safety and Health Programs. And it's a 4th-term class, it's a 5-credit course. And if you haven't enrolled in the class, please reach out to us. We would love to have a class this year. And
even if you've taken it.
And these are just some of the photos of the places we go. So some of the classes are in the classroom with experts in the field that come and talk to the students about occupational safety and health in different sectors.
Bruce Lippy's here, is one of the teachers who does that from CPWR.
Yeah, like so mining, construction, food sector. You can see us in the mine. We also go to the Museum of Industry, and I don't remember what I said. At the Coast Guard. That's fascinating too. We visited. So you talk about.
Sure. It looks like, so here we have McCormick Spice Factory, the construction site of the new building, the new Bloomberg School of Public Health building. We went right down into the pit, and wastewater treatment, and
That's the Museum of Industry.
The Museum of Industry, yeah. So a lot of good places to go to. It's really just an opportunity to apply everything that you've been learning in textbooks it's not actually applied because you're not actually changing anything, but at least you're proposing to change things. So
Work in an interdisciplinary mode, because we have the physicians and some nurses when we have them in industrial hygienists at the master's and doctoral level.
Yeah.
And I think, anybody want to guess what that is behind the students? That's sugar. at the Domino Sugar. That's where it comes from the barge into the, actually burned out a couple of years ago. Huh? I know, there's a new one. Yeah.
Because they didn't implement the stuff you said.
Yeah, right.
They invited us to the fire, so try again. Not that we set it on fire. Thank you very much.
Actually, one thing I forgot to put in the slides, we have this new initiative collaboration that we started with the Peabody Institute. There is a lot of interest in the Peabody, faculty at Peabody. And I'm learning a lot about their faculty. They've not really had a tradition of research of any kind. So they are mainly like, a music school, and they train musicians. But they have now a Bloomberg distinguished professor there, Chris Chesky, who was recruited to look at the performing arts and medicine. And so he has a joint appointment in the School of Medicine, but he reached out to the ERC a couple of years ago, and he even came and gave a seminar on occupational health aspects of musicians. So there is a lot of collaboration, and this past summer, there was this Performing Arts Medicine Association. It's an international organization. They had their annual meeting at the Bloomberg Center in DC. And I actually gave a talk there looking at occupational health and performing arts and occupational health issues. So they reached out to us. We didn't reach out to them. So there's a lot of interest there. And if any of you masters or PhD are interested in projects involving sound exposures or musculoskeletal issues, they have a lot of opportunities for work there, and they would love for our students to work with them. So with that, I'll stop. And does anybody have any things they want to announce or any questions they want to ask or discussions? Oh, yes.
Hi, everyone. I'm Rebecca Reindel. I'm a third-year DRPH student, and I work, can they hear me? Can you guys hear me?
Oh, you can come here if you want.
Oh, wait, okay. I work at the AFL-CIO, so I work with labor unions, and I wanted to announce a couple things. One is I'm trying to put together I'm in the process of putting together for those who will be at APHA or otherwise in DC, the Tuesday night, November 4th, moderated discussion in the House of Labor in our building between bridging the gap between public health researchers and labor and workers. And so it should be a really exciting discussion and wonderful networking. We're still in the works, so I'll send around a flyer or some information, but it'll be around 5:30 on Tuesday, November 4th, and we hope that everybody can make it. And then we'll probably go across the street after. We'll have some refreshments. The other thing is on the NIASH thing, I just wanted to let folks know that AFL-CIO has a hotline for you to call or to share with anyone you know, to call their representatives around NIASH. We have some talking points up there on our website. If you probably just Google AFL-CIO hotline, NIASH hotline, you'll probably find it, but if you need more information, I'm happy to share it. And then the third announcement is that I'm on the board of the Occupational Health Internship Program, which is funded by a TPG under NIASH, but we are planning for summer 2026. And this internship, I was an OHIP intern in 2008. That's how I got in the field. This internship pairs students, college, undergraduate and graduate students for 9 weeks over the summer with a labor organization, a union or a worker center to investigate health and safety hazards. So I welcome people to apply, but we're also currently looking for host sites. Right now we're in the planning stages of which worker organization and unions will be hosting. We will confirm those by December. The applications will open in December and students have to apply by January. So just wanted to let folks know about all those exciting updates. And yeah, nice to see everyone.
Thank you. So actually it'd be great if you can email all that to either me or Chris, and we can send it to the entire email group. Thank you.
And can I just add one more thing since we're kind of mentioning advocacy? I just want to highlight we were able to get a letter writing campaign up and running for anyone that's interested. I'm going to post the link here. I've already sent over 100, I think it was up to 200 last time I looked, letters to representatives and folks in support of OEM residency and ERC TPG funding. So just
You got muted.
I don't know how I did that. I have no idea how I muted myself, but I just posted the link here. If anyone's interested, it's very easy. It takes maybe 2 minutes to work through. It's basically a form letter that's already in a system, and it will route to whoever your congressperson or senator is in support of funding for ERC and TPGs.
Great. Thank you, Aisha. And again, if you can send that to me or Chris, we can actually put it on our email list. So.
Perfect.
Oh, you have, okay. Any other things? All right, well, thank you very much. And I think there's still some food left. So thanks again for coming again. So